If you're struggling to get it up, this video is for you. Because after researching over 300 men dealing with ED, studies show that 49% of men fail in bed because of their mind. But there is a proven way to get over the trap that keeps most men from getting it up. And in this video, I'm going to break down over 100 pages of real research, including the largest study ever done on erectile dysfunction, to fix it for you once and for all, by showing you exactly how to break the mental blocks that are stopping your blood flow from getting where it matters most. Because after talking to and helping hundreds of men, it's more common than you think. And I'll show you how to fix it in the next 11 minutes. Most men think erectile dysfunction is just a physical problem, involving blood flow, testosterone, or just getting older. But here's what doctors actually look for. Something called VENT. That's vascular, endocrine, neurologic, and trauma. The four main pillars causing your ED, excluding medications like finasteride or SSRIs that can mess up your function. But there's a fifth cause that no one is talking about, and it's the one affecting younger guys the most. It's called psychogenic ED, when your mind, not your body, is the main reason you can't get or keep an erection. But the crazy part is, there's nothing physically wrong with you if you have this. Your mind is just trapped in a cycle that's sabotaging you. And if you don't break this cycle, you'll avoid sex, ruin your relationship, and spend years thinking something's wrong when the fix is actually very simple. Here's how doctors diagnose psychogenic ED. They ask two simple questions. 1, are you able to get an erection on your own or when watching porn? If you say yes, that's a massive clue. And 2, do you get morning erections but have difficulty during sex? If you say yes to that too, you don't have a physical problem, you have a psychological one. And here's why that's actually good news. Psychogenic ED is treated very differently than organic ED, and it's much easier to fix. You see, if it's a vascular issue, you might need medications or even surgery. If it's endocrine related, that calls for hormone therapy. And nerve damage, that's a whole different beast entirely. But psychogenic ED is just your brain getting in the way. And once you understand what's happening, you can rewire it. But the problem is, most guys don't know this. So they suffer in silence, thinking their body is failing them, when really it's just a mental block. But there's something deeper going on that makes it even worse. Because once psychogenic ED starts, it triggers what experts call the vicious cycle. And this cycle is so powerful that it can turn a one-time failure into a lifelong pattern in just a few weeks. Here's what happens. The first time you fail to get an erection, maybe you were nervous, tired, or just had too much to drink. But the next time, your brain remembers that moment. And as things start heating up, your inner voice starts saying, I hope I can keep it up this time. And as you're thinking that, guess what happens? This is the vicious cycle. The fear of failure creates performance anxiety, which kills your erection, causing even more fear. And here's the worst part. You start avoiding sex altogether. Your partner might be patient for a while, but eventually they'll start to get frustrated, even if they don't tell you. But there's another dark side. 66% of men with ED also have depression. Not because depression causes ED, but because this cycle destroys your confidence and makes you feel broken. But here's what's actually happening in your body during this cycle. When you're anxious, your sympathetic nervous system activates. That's your fight or flight response. And when that system is on, it literally blocks the parasympathetic system that creates erections. So your anxiety isn't just in your head. It's physically preventing blood from flowing where it needs to go. That's why your morning erections are perfectly normal. You're relaxed, there's no pressure, and your mind isn't getting in the way. But the moment you're with a partner, that fear kicks in, and your sympathetic nervous system shuts everything down. And the more you fear on not losing your erection, the worse it gets. But there's a solution that breaks this cycle in as little as 30 days. And once you understand it, it will allow you to be confident every time you initiate with a girl, last longer in bed, and be able to go multiple rounds, giving her and you a better time. And if you want to know which type of ED you have and break it in the next 30 days, check out the link below. This solution combines a mental technique with a simple daily medication that gives your brain the confidence it needs to reset. And once you understand how this medication actually works in your body, you'll see why it's so effective at breaking the psychological pattern. The solution has two parts. First, sex therapy or cognitive behavioral techniques. You see, many guys don't want to see a sex therapist because it's awkward and it's also inconvenient. But the technique is very simple. You just redirect your focus away from performance and towards sensation. So instead of thinking, I hope I don't fail, you only pay attention and focus on what you're feeling right now. This helps train your brain to stay calm and focused in the moment, helping you get more and more aroused. instead of staying stuck in your mind. Which brings us to the second part, daily low-dose Cialis. Now here's why this works for psychogenic ED, even though it's a mental problem. Let me explain how Cialis actually works in your body. When you get aroused, your body releases nitric oxide. That causes an increase in something called cyclic GMP. Now cyclic GMP relaxes the smooth muscle in your penis and allows blood to flow in, creating an erection. But there's an enzyme called phosphodiesterase that breaks down cyclic GMP. It's like a cleanup crew that ends your erection. So what Cialis does is blocks this enzyme, allowing cyclic GMP to stay around longer so blood keeps flowing in and your erection stays hard. But here's the psychological magic. When you take only 5 milligrams daily, it's always in your system. You don't have to plan ahead or take a pill like Viagra. You just know it's working. So that confidence breaks the vicious cycle. You quit overthinking, you get out of your head, and you start having passionate sex again. Your brain learns that sex doesn't equal failure anymore. And in addition, you last longer, stay harder, and climax even more. And eventually, many men can wean off the medication completely because the psychological pattern has been broken. But psychogenic ED is also a warning sign. Studies show that 15% of men who develop ED have a heart attack or stroke within 7 years. Not because ED causes heart disease, but because both are symptoms of the same underlying issues: chronic stress, poor vascular health, and inflammation. Your penile arteries are only 1 to 2 millimeters wide, whereas your coronary arteries are 3 to 4 millimeters. So the small arteries show problems first. ED is basically your body's check engine light. And if you're dealing with psychogenic ED, it means your stress and anxiety levels are so high that they're literally shutting down your body's natural functions. That's a real health problem. But here's the good news. When you fix this psychological pattern, you're not just fixing your sex life. You're reducing your overall stress, improving your mental health, and potentially preventing serious cardiovascular issues down the line. Now, 40% of men at age 40 deal with some form of ED. So if you have this, you're not alone. Your brain just got stuck in a pattern. But the good news is, now you know how to break it. Fixing psychogenic ED is just one piece of the puzzle, because for some men, it's a mix of vascular issues, hormones, medications, or nerve-related problems, all happening at once. That's exactly why I developed a protocol that I've been doing recently that has allowed me to have the highest libido of my entire life without any ED. So check out this next video where I show you exactly how.